Hi, my name's Emily, and today I'm going to talk about the drug Doxorubicin in the treatment of canine lymphosarcoma. I'll also evaluate the evidence for its efficacy in the literature. Lymphosarcoma, also known as lymphoma, is one of the most common malignant cancers in dogs. It's due to the uncontrolled proliferation of neoplastic lymphocytes, which you can see on the screen there. It can spread locally or systematically, but it often localises in organs of the immune system, so the lymph nodes, spleen and the bone marrow. The cause is unknown, but there's thoughts that it could have a genetic component, could be due to bacterial or viral infections, exposure to chemicals, or some environmental factors. The clinical presentation of lymphoma is variable, but what we commonly see are enlarged peripheral lymph nodes, polyuria and polydipsia, anorexia and vomiting. Unfortunately, lymphoma is a fatal disease. The goal of treatment of lymphoma is not to cure the disease, but rather achieve the longest possible clinical remission and survival times with limited side effects. Dogs diagnosed with lymphoma are only expected to live 4 to 6 weeks if they don't receive any treatment. Chemotherapy is what we use to treat. There are single and multi-agent protocols, which I'll discuss, but it's important to consider patient factors such as the age of the dog, other health problems, quality of life, as well as owner considerations, so financial costs, their perception of the dog's quality of life, and their time commitment to the treatment. Doxorubicin is currently one of the most effective chemotherapeutic agents to treat canine lymphoma. It's an anthracycline antibiotic anti-neoplastic drug, and similarly to other anti-neoplastics, works by inhibiting DNA synthesis. By doing this, it prevents cell division and spread of rapidly dividing cancer cells, which in this case are lymphocytes. It should be noticed that it's a strictly intravenous injection, and it's really dangerous if it's injected intramuscularly or subcutaneously, and PPE should be worn by vets and nurses administering the drug. As well as being dangerous when administered IV, the other side effects of doxorubicin include bone marrow suppression, gastroenteritis, and cumulative cardiotoxicity. Because of this, there is a limit to the amount of doses of doxorubicin a dog can receive, and it's advised that dogs with pre-existing heart conditions aren't treated using doxorubicin. The protocols that currently exist to treat lymphoma originate from human chemotherapies. Doxorubicin can be used in both multi-agent and single-agent protocols. The multi-agent protocols involve weekly treatments of rotating anti-neoplastic drugs. One of those would be doxorubicin combined with daily prednisolone. This goes on for a total of 25 weeks, whereas in your single-agent protocols, you're just using the drug doxorubicin, and you're using that to treat every 3 weeks for 5 treatments. So in summary, your multi-agent protocols a longer time period with more injections, whereas your single-agent protocols go for a shorter time period with less injections. Since lymphoma is fatal and the goal of chemotherapy is not to cure the disease, when reviewing the literature for the efficacy of doxorubicin, efficacy is considered high when a long survival time and minimal side effects are achieved. The efficacy of protocols involving doxorubicin in dogs has limited evidence in the literature. Very few randomized clinical trials have been done in dogs, and studies that have been performed commonly conclude that randomized prospective trials are required with a larger sample population to confirm their preliminary findings. From the studies that are published, it seems positively suggested that the inclusion of doxorubicin in treatment protocols greatly improves patient outcome. Several studies suggest that multi-agent protocols that include doxorubicin are more successful in treating lymphoma than protocols excluding doxorubicin. Multi-agent protocols have been shown to induce clinical remission in 80 to 95% of dogs, and approximately 25% of these dogs survive longer than 2 years. Single-agent protocols don't appear to have as long survival times as those seen with multi-agent protocols, but are still an effective alternative option that is less costly, less time-consuming, and a less aggressive form of treatment. These studies have shown clinical remission rates of 60 to 85% and a median survival time of 6 to 9 months. If their circumstances allowed, I would encourage owners of dogs diagnosed with lymphoma to pursue chemotherapy that involve doxorubicin, either in a single or multi-agent protocol. Since the life expectancy of dogs diagnosed with lymphoma is so short, the reported length and quality of life associated with these treatments seems positive and worthwhile. The risks The therapeutic benefits seem to outweigh the risk in most dogs, although I would think twice about recommending doxorubicin in dogs predisposed to dilated cardiomyopathy, dogs with pre-existing heart conditions, and dogs that have already received the ceiling dose of the drug due to its cumulative cardiotoxicity effects.